All right, we are now recording. As you all know, that whenever I record it from here, it literally takes just an hour, 2 hours, something like that, for it to show up, and it sends me an email, and that's when I put it into the calendar on Navigate. I usually try to load it into the calendar on Navigate for the day that the class recording was held, or the day the class was held. I put the recording in there for that day. So if you want to go back over it or what have you, then you're more than welcome to do so. And also, if you do it from that way, then it's easier for me to take attendance as well. I can see that you reviewed the class. If you go and you use it through the Navigate, I can actually see that. All right, so let's rock and roll with this. All right, today we'll be going over Chapter 5, Medical Terminology. It's not a very big chapter, so we may finish up early, and that's good. Did anybody think of anything while I was out that we may need to go over? Okay, didn't see anything just yet, so we will move on. Go through the EMS competencies. So the language of medicine is derived primarily from Greek and Latin terms, as you know, or as you may know. If you understand the origin of a medical term, the components and the guidelines for forming words, you'll be able to identify and use medical terminology correctly and communicate effectively with other healthcare providers as well. So when you're looking through the figures, they're broken down, and we're going to get further into this. I'm not going to explain it all right here. So incorrect medical terminology. This could lead to ineffective or even harmful treatment. So if it doesn't read correctly, or if the terminology put on there, it may misdiagnose or give a incorrect treatment entirely, depending on what you put. All right. So make sure that you know, and there are some that are pretty close, but they don't mean the same thing. And then also, as it says here, it could cause the patient to lose trust in your ability. You can't even speak right. So if you can't speak right, then of course I'm not going to trust your ability after that, right? So let's make sure that we know what we're talking about, and make sure that we're using the correct terms. Use them often. If you're not sure that it's correct, don't use it at all. Don't even try. Make sure you know that the terminology you're using is correct. If you can't use the correct terminology, break it down in some other form or fashion. Okay. And I mean that, like when we talk about what is the abbreviation normally used for hypertension? Does anybody remember that? Somebody throw it up there. HTN, that's right. That's right. Now, if you weren't correct and you put something else down, you weren't correct about it, then that could cause a lot of issues, right? What is the correct abbreviation for by mouth? For orally, we'll go over that. Or what about twice a day? What's the correct abbreviation for twice a day? That's correct. What's the correct for twice a day? BID, that's right. So you see how you can easily mess things up if you're not paying attention. And those are just simple terms, right? All right, so comprehension of the key terms, acronyms, symbols, and abbreviations for this it's very important. you'll break down each word into its separate components. It's going to be by the prefix, the suffix, and the root of the word. Okay. And then you'll learn to establish, you'll learn what the established and accepted medical terms are and abbreviations for your local area, because there'll be some abbreviations that are allowed. There'll be some abbreviations that are not allowed depending on your local policy. So you'll need to know those as well. And then there's also common slang terms that are used in EMS also. But you can always download a terminology app, a medical terminology app, or carry a field guide or documentation handbook to look up and quickly. I used to use one on my phone just in case, and then as you start to use them often, you don't even need it anymore. Or whenever you're looking at stuff from a doctor or from another medic, you may need to look into it and look them up. All right, as we said before, most of your medical terms have Greek or Latin origins. Now, medical terms that refer to disease are derived from Greek terms. Words that refer to anatomic structures usually come from Latin words, right? And then you have what's called an eponym. An eponym is a name of a disease, a device or procedure, or a drug based on the person who invented or discovered it, or first described it. We'll see a lot of those. You see, like I talked about earlier, Brooks Parkland formula, Brooks formula, Parkland formula, Babinski. We'll talk about stuff like that all throughout. Foley catheter, like this one uses, McBurney point, Foley catheter, Babinski reflex, Crohn's disease, cesarean section, Levine sign, Apgar score, so on and so forth. All right. And then homonyms are pairs of words that are pronounced almost. They're almost the same way, but they're spelled differently and have different meanings. An example of that would be like ilium, I-L-E-U-M, and then ilium, I-L-I-U-M. Okay. We'll look at those. And then antonyms. Antonyms, they're pairs of a root word, prefixes or suffixes that have the opposite meaning of another word. Opposite meaning, antonym. So an example, EU or you, good, and mal, like malfeasance or anything like that. Yeah, dysphagia and dysphagia. That's right. Good one. And mal being bad. Ad being toward, AD, or ab, away from. When we talked about adduction or abduction, then we'll get into that. It's easy to get those messed up. Now, up next is synonyms. And synonyms are pairs of words, roots, prefixes, or suffixes that have the same or almost the same meaning. So examples of prefixes of pneumonologist and pulmonologist both mean lung, right? Pneumonologist, pneumo, air, right? And then pulmo, also lungs or air, but pneumo, more of air. They both mean lung. So some of the components of medical terms, distinct parts of medical terms that perform specific functions. So like a prefix, the portion that appears before the root word. Suffix, that's the portion that appears after the root word. The word root is the foundation of the term. And combining vowel. So vowels that link one or more word roots to another component of a term. And then the way in which the parts of the word are combined determines its meaning. Talking about it doesn't sound that great. When we start getting into it and start breaking down some of these words, it'll click. You'll actually click. So the prefix, it appears at the beginning of a word and generally describes the location or the intensity of the word that follows, right? Also, it's used to specify time or to indicate unaccountable or uncountable quantities. The prefix also, it changes the meaning of a medical term as a whole by describing the what, the how, the why, or the when of the root, right? Some examples of that would be sub means below, right? Cutaneous means skin. So subcutaneous means what? Under the skin, below the skin. That's right. As well as hypo means what? I know y'all read this. So hypo means low, right? Volemia means what? So blood volume, that's right. So vol, blood for volume, emia, blood, right? So altogether, hypovolemia means low blood volume. Awesome. And then you have hypoglycemia. So hypo, we already know low. Gly, usually means what? Sugar. That's right. So emia meaning blood, and then so glucose. Glucose. So low blood glucose. All right. So then you have also a numerical prefix. It's used to indicate a number of sides, limbs, or sensory organs affected, right? So example, octo, 8. Okay. So octogenarian would mean what? Geriatric, so person between 80 and 90 years of age, right? It's generic. So person between 80 and 90 years of age, generic, generic, and Aryan, generic. So geriatric patient would be 80 to 90, 80 to 89. I know that was confusing because I put the word geriatric in there. My apologies. All right. Next up, we have the suffix. So the suffix is the component added to the end of the word root, right? It changes or adds the word's meaning, provides further definition of the rest of the term. And in the medical terminology sense, a suffix is usually used to specify a procedure, a condition, a disease, or part of speech. Example, ASE indicates, or ACE indicates enzyme, okay? And then LIP, lip, or lipe, like lipo, means fat. So lipase is an enzyme that digests fat, lipase. A's being the enzyme, suffix, the end, right? Lipe being fat, so fat enzyme. All right, so the word root, it established the basic meaning of the word and frequently indicates a body part. So prefixes are added to the beginning of a root word and suffixes are added at the end of a root word, right? So there are several root words that are used to describe color. So like cyan or cyano, blue, leuco, white, erythro, red, right? Sear or siro, sir or suro, like cirrhosis, be yellow, right? Melon, like Milan, be black. Milan, pink, no, black, Milan. Poly, be gray. Alb, like albino, would be white as well, like leuco is white. Alb or albino would be white. And then chlor, like chloroform or chloroform, chlorophyll, not chloroform, chlorophyll, like on plants, chlor being green, right? Chloroform. More like boroform, chlorophyll. I don't know if all of y'all have seen that. All right. So combining forms and vowels. Combining vowels facilitate the formation of a new, more complex term. To make pronunciation easier, sometimes it's necessary to change the last letter or the last few letters of a word, root or prefix, when a suffix is added, okay? Yep. A combining form, a combining form is it's a word root, prefix or suffix with a combining vowel. So examples like osteopathic, the first word root is osteon, which is Greek for bone. And then the N is dropped, all right? And the combining vowel O, so O in there, is added to create the combining form. So osteo, and then adding the O, it facilitates the addition of a second combining form. So pathy, from the word root patho, meaning disease, patho, disease, right? Some guidelines for adding combining vowels to word roots. Use a combining vowel before a suffix that begins with a consonant. So cite or CYT, O plus LOGY. So you have CYT being what? So, and then you take the combining vowel, which is the O, cyto, and then ology, study of, right? Cytology, 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 whatever, however you want to pronounce it. Okay. And then you can also use a combining vowel to join other word roots like gastra, GASTR, meaning what? Usually stomach, having to do with stomach, right? And then you take that O to combine it into enteritis. So enter would be what? Like the lining, right? And then itis. So itis being irritated or yeah, irritation. So gastroenteritis. So irritated stomach lining. All right. Now you do not use a combining vowel before a suffix that begins with a vowel. Okay. Or Leanne's writing the mess out of some notes right now. Don't forget to carry the 1. All right. So, compound words. Compound words are terms that contain more than one word root. So each word root retains its basic meaning. Some examples of that would be electrocardiogram. So electrocardiogram. And then thermometer, okay? More of those words. All right. So rules to change a medical term from singular to plural. Okay. In most cases, add an S to a singular word, but for medical terms, it gets all sorts of silly. So singular words ending in A, you change to AE. Okay. So like vertebra, meaning one vertebra, vertebra, however you want to say it. And then I don't have any more pencils up here, so I can't add anything. It's hard for me to talk with my hands when I don't have all the tools to do so. So to make that plural, you would just take the A and put an E on the end, make it AE. And then you take and it'd be vertebrae at that point, vertebrae being the plural term. So singular words ending in IS change to ES. So diagnosis becomes diagnoses. Diagnosis. Instead of cis, it's now says. All right. And then singular words ending in EX or IX changes to ICES or ISIS, right? So example of that would be like apex. Apex now becomes apices. APICES. Singular words ending in ON or UM change to A. So example, like we talk about a ganglion, like a ganglion cyst, ganglion. Now it becomes ganglia. Okay, ganglia. Singular words ending in US or us change to I to become plural. So example like bronchus now becomes bronchi or bronchi or however you want to say it. Okay. Clear as mud. All right. Up next, topographic anatomy. This is very important because when you talk about a patient or when you're speaking, when you're at the hospital doing your handoff or when you're speaking to another medic, it is very important that you use the correct terminology. All right, when you do this. Now, there's some things that, you know, I want you to definitely intake here, but there's some things that you won't see that much in the field. And when you hear it, you're like, what century did that guy come from? Whenever they say certain things, you'll know what it is. But we're going to learn the book way, which is everything. All right, Dan. So topographic anatomy, it's superficial visible features on the surface of a body that serve as guidelines or landmarks. Taken together, these features make up a body's topography. So anatomic position is person standing facing you, arms at his or her sides, with the palms of the hands facing forward, okay? Facing forward. So the thumbs point away from the body. All right, point away. Okay. So it's that's how we, or that's the way we stand or we think of things in our mind when we describe topography correctly or accurately. All right, so anatomic planes and axes of the body. So an anatomic plane is an imaginary surface dividing the body horizontally and vertically. You see here and here. Okay. These planes. All right. Divides it into sections. So the coronal plane divides the body vertically from ear to ear. From ear to ear, the coronal plane. Okay. Now it's going to divide it into the front, which is ventral. Okay. And then the back, dorsal. So in the back here. That's what this is right here. This whole blue, that's that coronal plane. Okay. Then you have what's called the transverse or axial plane. It divides the body horizontally at the waist. Transverse plane, the green. Then you have the sagittal, which is the lateral plane, and it divides the body vertically front to back. Front to back. Okay, so the sagittal, here to here, right? And it's pointing this way. Boom, 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 boom. Not cutting it in half, but cutting it this way. Front to back. Okay. Right. Mid-sagittal plane divides the body into equal left and right halves. So sagittal is front to back, right? Mid-sagittal would be left side, right? Left side, right side. An axis is an imaginary line that divides the body equally and creates a point of rotation, right? So antero-posterior axis. And then perpendicular, that's going to be perpendicular to the coronal plane. And then you have the longitudinal axis, which is going to be perpendicular to the transverse plane. Then you have the horizontal axis, which is perpendicular to the sagittal plane. This is also called the mediolateral axis. That horizontal axis is also called the mediolateral axis. Mediolateral axis. All right. A cross section is taken by slicing an object perpendicular to its long axis. A longitudinal axis is a view of an object cut along its long axis. All right, so moving on. Specific areas of the body. Many body areas go by specific names. AMTs rely on anatomic planes, body surfaces, and imaginary lines to describe the location of the injury. Okay. Example would be sternocleidomastoid muscle. Where do you think that is? Sternocleidomastoid. Okay. And that muscle, yep, in the neck. Awesome. Okay. So the sternocleidomastoid muscle is in the neck, and it's a combination of the sterno, cleido, and mastoid, which refers to the sternum, the clavicle, and the mastoid process. So right on, right on the side there. All right, so body cavities, dorsal cavities, like your posterior, include the cranial cavity and spinal cavity. So the cranial cavity and then the spinal cavity. And then you have ventral cavities, which is anterior, which is towards the front, right? It includes the thoracic cavity, abdominal cavity, and the pelvic cavity. Directional terms describes the position of body parts as well as imaginary anatomic divisions. It occurs in pairs. So superior and inferior. Superior portion is the portion above or closest to the head from a specific reference point. Inferior portion is the body part closest to the feet. Lateral and medial are parts of the body that lie further from the midline, are lateral. So from here, and you're talking about something this way, this is towards lateral, okay? And then if we're talking about in the center here, towards midline, okay? Proximal and distal, that's why we call it your distal pulse, right? Because it is distal to the heart. Distal, it's further away. And then proximal, okay? So we come up here, that's closer towards the heart, closer towards the body, or towards the trunk. Superficial and deep. Superficial is closer to the surface. So when we say superficial burns, like your sunburns are superficial burns because it's close to the surface. And then a full thickness burn or a deep tissue burn, deep down, right? Down. And then you have anterior and posterior. Anterior refers to the belly side of the body, the front side of the body. And then it's also called ventral, but you'll hear anterior most of the time. A lot of times you'll talk about that, and you talk about when we're talking about descriptions. What you hear a lot of times though is in airways. When somebody's trying to intubate somebody or something like that, they'll say that they were very anterior, and it's because their structures in here were more towards the front, and that's why they have to do things called like the burp maneuver or what have you, because they're anterior. Okay. And then also when we talk about the back, like the back of the hand, because remember, you're facing this way, right? Down here this way, back of the hand would be dorsal, right? Like a dorsal fin on the back of a dolphin. All right, and that is table 5-9 out of your book. Your internet reset itself. I don't know how much you missed. A ton. Oh my gosh. You'll never be able to catch up. It's terrible. No, we're still going over the same thing. All right, so there's some common directional terms. And this is a lot to study. This is why this is so short. There's a lot of information here in a short time, and it's because it takes practice to get this learned. It takes a lot of practice. So that's why this lesson is going to be short, going to be short to give you a lot more time to study. So movement and positional terms, range of motion is the full distance a joint can be moved, right? Full range of motion, because there's only so much motion that this can do or supposed to do. So flexion is moving the distal point of an extremity towards the trunk, right? So flex, like flexing a muscle. I'm not going to do it. We're just going to flex it this way. All right. And then extension. So extension would be away, right? Okay. Now, abduction would be extremity moves away from midline. So, which would be what? If I had my hand down here, abduction, and then one to adduction, I'm adding towards my midline. Taken away, taken away, add, adding to, right? Just looks like wing flapping. All right. So the next is movement and positional terms. So this here, it's going to show you the positions of the neck a patient is found in a supine position. All right. So neutral. See all flat across here, right? Flexed, because the chin is more towards here. Flexing the chin in. And then extended. See, chin's away, chin's further away. Okay, you can see there. All right. All right, so movement and positional terms continued. Hyper indicates a mechanism of injury, excess movement. So like hyperextension, hyperflexion. Hyperflexion refers to a body part that is flexed beyond its normal range of motion. Hyperextension refers to extension of a body part beyond its normal range. So if you had this like this and I were able to make it go further, it'd be an extension, right? Okay. All right, so turning the palms upward toward the sky constitutes supination or supination of the forearm, right? And then turning the palms downward towards the ground pronates the forearm. Pronates. Supination. Pronation. Okay. Internal rotation, turning the anterior portion of the extremity towards the midline. So internal rotation this way, right? Bringing it in. This is so weird doing it on the camera. External rotation, all right, away from the midline. Probably looks like I'm up here dancing. Be a terrible dancer. All right, so other directional terms. Bilateral. It's a body part or a condition that appears on both sides of the midline. So examples are like eyes, ears, hands, and feet. So some of the stuff like when we're doing documentation, bilateral, equal and bilateral chest rise and fall. Both pupils were equal bilateral. All right, equal on both sides. Chest rise and fall equal on both sides. Bilateral. Unilateral structures appear only on one side of the body or the other, such as like we talk about the spleen is on the left side of the body and the liver is on the right. Okay. And then you have ipsilateral, which refers to the same side of the body. And then you have contralateral, refers to the opposite side of the body. All right, the abdominal cavity is divided into 4 equal quadrants. Yeah. Okay. And then, which is going to be the RUQ, is what you would write, but that means right upper quadrant, right? LUQ, left upper quadrant, right lower quadrant, left lower quadrant. And it's because it's the patient's right, patient's left, right? Left, right. Correct. And then from there, it's divided into regions. All right. So some prefixes indicating position, direction, and location is what we're going to talk about next. Specialized prefixes specify position, direction, and location. That's to describe the movement of the body or something within it. It's going to indicate the location of an organ, a foreign body, or a mass. And then it's going to refer to the direction of radiation or ultrasound waves as well. So position of the patient. So specific terms describe the patient's position on the scene. So prone, meaning lying face down, the prone position, which is going to be which one? Which number is prone position? C. That's right. C. All right. So if prone is face down, then supine would be which position? B. That's right. And then Fowler is going to be which position? A. That's right. A. And then the recovery position is going to be D. Last one. Okay. It's also known as what? Left lateral recumbent. That's right. All right. So abbreviations, acronyms, and symbols. Medical abbreviations, acronyms, symbols enable faster communication. Do not trade speed for accuracy in patient care, though. Use only commonly understood acronyms and other abbreviations. And you will most definitely hear all sorts of words that people will make up and what have you as you go. It's crazy. If you don't understand it, don't be afraid to ask, because that may mean a different treatment or diagnosis for that patient. So all acronyms and abbreviations, but not all abbreviations are acronyms. Makes sense, right? All acronyms are abbreviations, but not all abbreviations are acronyms. Okay. An abbreviation is pronounced with each letter separately. Example, EMT would be an abbreviation. An acronym forms a word like Urban Search and Rescue, USAR. Okay. And then an abbreviation is still considered an acronym if it is pronounced as a word. For example, Health Insurance Portability and Accountability Act, or as we so know it as HIPAA, right? HIPAA, HIPAA. All right, medical abbreviations. They take the place of words they represent to shorten patient care notes, mainly, and can be very useful for documentation. Must be consistent, though, and has to be approved by your EMS system. So definitely make sure that you know your documentation system or what's allowed. Thirsty. All right. So error-prone abbreviations, some that are very error-prone. The Joint Commission and the Institute of Safe Medication Practices, or ISMP, have each published a do not use list of abbreviations to prevent serious errors. Yeah, that's correct. A do not use list. All right. So example, HS on a prescription can mean hour of sleep or half strength. That's crap, right? We avoid using trailing zeros after a decimal point, but include leading zeros prior to the decimal point. So we don't use 5.0 milligrams because that could be read on accident as 50 milligrams if they can't see the point very well. And then we do use 0.5 milligrams, not 0.5 milligrams, because that could be read as 5 milligrams instead of 0.5 milligrams. So make sure you put your zeros in the right spot. So these are some commonly used symbols. We start talking about those like beta antagonist, alpha antagonist. Approximately, I use that one pretty good amount. These get confusing if you don't use them all the time. Yes, I know. But that's generally I use this one. And I don't use these in documentation, or there's a few of these. There's a lot of these I don't use in documentation. Actually, there's only a few. All right. So medical terminology related to pharmacology. It's important to be familiar with terminology that's related to medications and medication administration, such as the common prefixes, common metric conversions, and then common medical abbreviations. And make sure we know those as we go through. Here's some common ones that are used for medication administration, and we're going to get into pharmacology and medication administration, so don't think that I'm cutting you short here. We'll definitely be getting into that. and medication math and all that awesome stuff. It'll be great. All right. What I tell you, it was going to be fast today. All right, so all that really means is that you have plenty of time now to get in there and study. I played with the idea of going over chapter 6 or chapter 7 to kind of, but I don't want to screw up our dates. I don't want to mess up our dates anymore than we have to. I know the class that I had beforehand that I only came in like at the end of it, man, it was way off. The days were way off. And I don't want to get into that. So I'm going to try and keep us on our timeline just right. If that means getting out early, then that means getting out early. But there are a couple things that I said I would do. First off, does anybody have anything they want to bring up? And I'm going to stop recording.